Hi, you guys. Welcome back for our daily practice questions. It is day 96, and as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder, and that's we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. And if you're looking to join the upcoming 5-week review that starts on April 21st, be sure to click the link in the description. Question number one states a 40-year-old male presents with knee pain after twisting his knee while playing recreational basketball. He reports a feeling of popping at the time of injury, followed by swelling and limited mobility. The patient complains of pain along the joint line, particularly when squatting or twisting. There is mild swelling around the knee, but no signs of instability. Based on the presentation, what is the most likely diagnosis? Is it A, patellar tendonitis, B, meniscal tear, C, an ACL tear, or D, osteoarthritis? Take a moment and tell me what you got in the comments, y'all. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, based on the presentation, what is the most likely diagnosis? And y'all know what I say, if we're looking for a diagnosis, we need to run it back and look at those assessment findings. How is the patient presenting? What are the signs and symptoms? What are the chief complaints? What is noted on exam, right? So we have a 40-year-old male who comes in with knee pain after playing recreational basketball and he twisted his knee. He felt like he had like a popping sensation at the time of the injury, complains of pain along the joint line, and there's mild swelling noted, right? Doesn't show any instability though. When you think of that presentation alone, you should think of B, a meniscal tear. That popping is one of those key identifiers for meniscal tear. When it says there's no signs of instability, that should help you begin to rule out an ACL tear, right? When there's an ACL tear, that's why when you do like the drawer test, you will have that shifting because the ligament is torn with ACL. So it'll be instability noted, right? A meniscal tear is different. There shouldn't be instability, okay? So your best answer here is B, a meniscal tear. Question number two, a 55-year-old woman presents with persistent knee pain that began after a twisting motion during gardening. She experiences pain along the joint line and difficulty with activities like squatting or going up and down stairs. During your exam, you perform the McMurray test, which elicits a click and a sharp pain in the medial aspect of the knee. What does a positive McMurray's test indicate? Is it a possible ACL tear, B, a possible patellar dislocation, C, a likely meniscal tear, or D, osteoarthritis of the knee? Take a moment and tell me what you got in the comments, y'all. All right, so stem of the question here states, what does a positive McMurray's test indicate? All right, and that alone is why reading the stem is so important. You see how this explains what the question is. What does a positive McMurray's test indicate? And you would say C, right? It's likely that you have a meniscal tear, McMurray and meniscus, right? Remember the test that you do for specific diagnoses. So meniscal tears, we do the McMurray's test. That click, popping are all key indicators of positive findings on those exams as well, okay? C, a meniscal tear. All right, and lastly, question number three. A 28-year-old male athlete presents with knee pain after twisting his knee during a basketball game. The patient reports that his knee swells immediately after the injury, and he experiences difficulty fully extending his leg. MRI results confirm a tear in the medial meniscus. What is the most appropriate next step in management for this patient? Is it A, immediate surgical repair of the meniscus? Is it B, recommend rest, ice, and physical therapy only? Is it C, symptomatic management with rest, ice, NSAIDs, and follow up to evaluate for surgery? Or D, apply a knee brace and refer for long term rehab? Take a moment and tell me what you got in the comments, y'all. All right, stem of the question: what is the most appropriate next step in management for this patient? All right, so when we're doing treatment and next step in management, you're thinking treatment, right? Your plan of care. We need to make sure we have a diagnosis. Here, meniscal tear is your diagnosis. It tells you that we have confirmed this with an MRI. So, how do you treat this and what's your next step? So, C would be your best answer because we're going to provide that symptomatic management, like telling them to apply ice, telling them about NSAIDs or prescribing a higher dose NSAID to help with the inflammation, telling them to rest that knee, and having them to follow up with surgery, the orthopedic surgeons to evaluate and plan for surgical repair. Okay, so C is your best answer. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Everything that I offer is linked in the bio of this channel. And if you're looking to book any of my one-on-one sessions, any of my custom packages or plans, or any of my question analysis sessions, I always say either call, text, or email, as I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.